Welcome to Riccardo Farina, Policy Officer at the Department of Health and Social Policies of the Autonomous Province of Trento and Project Manager of Trentino Salute Plus. So Riccardo, let's talk about the scope of your mHealth practice.
Thank you, Marcia. Trentino Salute Plus is an app explicitly developed for promoting healthy lifestyles in accordance with the first macrothematic objective of the Trentino Health Plan for the period starting from 2015 up to 2025. More years in healthy life. So the promotion of healthy lifestyles triggers dialogue between different entities, citizens, provincial governments, social cooperatives, associations, and commercial partners, following the paradigm, the healthier is your behavior, the greater your help to others, and fostering the creation of a virtuous community.
Thank you, Riccardo. What about the main ideas around the project?
The project idea was born following the public discussion which took place during the Trento Festival of Economics of 2017, focused on unequal health. Between the Councillor for Health and Social Policy of the Autonomous Province of Trento, a representative of the World Health Organization, and a representative of the National Agency for Regional Health Services. The app was officially launched during the 2018 edition of the same festival, the Trento Festival of Economics, and then made available to download in the June of the same year.
And Riccardo, let's talk about the key steps that were undertaken.
Well, some months after the public event which took place in Trento in 2017, an interinstitutional working group was created in order to define the contents of the project. Then the group was coordinated by representatives of the Department of Health and Social Policies and involved the Provincial Healthcare Trust of Trentino, the APSS, and the Bruno Kessler Foundation, following the framework of the Competence Center for Digital Health Trentino Salute 4.0, in which the same subjects collaborate.
Which are the strengths and weaknesses of the implementation process?
The main strength is that the initiatives was strongly endorsed by the institutional side, which sped up its implementation. Then the formal approval of the initiative through Provincial Act guarantees its reliability to all the stakeholders involved, citizens, social cooperatives, associations, and commercial partners. On the other hand, a leading formal act implies that any modification to the initially foreseen plan has to undergo to the modification of the act itself, which can sometimes lengthen the time for a quick provision of the service.
I mean, is there any further documentation about this approach?
The initiative Trentino Salute Plus was formally approved through the resolution of the Provincial Council of Trentino, number 535 of 2018, which, among other contents, identified the timeline to follow for its implementation for about 3 years, from the first semester of 2018 up to the 31 of December 2020.
And which are the strengths and weaknesses of the solution instead?
Well, the first strength is a privacy and security by design approach in the development of the solution. The second strength is the implementation of an innovative incentive system for the user based on 2 levels, personal and social. Using the app and participating in the health challenges, the user gets offers and discounts from associated partners like gyms, swimming pools, healthy food shops, and earns social points with which it can support the social initiatives selected by the Project Steering Committee. When a social initiative reaches a prefixed threshold, it can be financed up to 5,000 euros through a dedicated fund allocated by the provincial government. The third strength is that Trentino Salute Plus has been designed to be a serious game in the health sector. On the other hand, the main weaknesses are the current release of the solution implements a virtual coach which is too basic, and the food diary that the user is asked to keep to evaluate the overcoming of the health challenges is not much user-friendly, and the lack of integration of a pedometer for monitoring physical activity, which instead must be entered manually by the user.
Talking about stakeholder, which are the stakeholders involved and their roles and activities?
Well, the shared governance already put in place through Trentino Salute 4.0 allowed to quickly engage the Autonomous Province of Trento as decision maker, the Provincial Healthcare Trust as provider of services, and FBK as research institute. Then some institutional meetings took place to reach particular categories of stakeholders, like general practitioners, pharmacists, voluntary association related to particular pathologies, and active citizenship. Commercial partners were then identified inside the areas of interest for the project and then contacted directly. Citizens were involved through voluntary associations and through an information campaign that exploited all media and social channels. The Autonomous Province of Trento was the promoter of the initiative. It coordinated the working group and it made available resources for the implementation. The Provincial Healthcare Trust supervised the contents related to healthy lifestyles, and FBK, with the support of a private IT company, developed technology to support the initiatives. Commercial partners made available offers and discounts for citizens. Social cooperatives and associations had the opportunity to promote initiatives related to the promotion of healthy lifestyles. Last but not least, citizens. They were engaged in health challenges to enhance their lifestyles and to own social points for supporting health initiatives. So we can state that an effective quadruple helix approach was followed, where each stakeholder was in a win-win situation.
How was involvement and buy-in in the stakeholders secured?
Of course, the Provincial Healthcare Trust and FBK were easily involved in the framework of the Competence Center of Digital Health, Trentino Salute 4.0. Commercial partners, social cooperatives, associations, and citizens were involved through public events where people were even supported in downloading the app from the stores and starting to approach with it.
Were there any obstacles you experienced, and how were they overcome?
Well, the main obstacles were of a technical and organizational nature, and they were related to the easy access to discounts through the app. More in details, well, in the case of large retailers, there was the difficulty of integrating the app with their proprietary authentication systems. While in the case of small retailers, there was indeed the difficulty of automating the process by which the user claims and the retailer applies the discount, so that the app keeps track of it. So this obstacle have not yet been fully overcome. A major obstacle has been instead represented by COVID-19 pandemic outbreak, of course, which unfortunately prevented the engagement of a wider number of stakeholders and citizens on the territory that was initially planned to release a fully operational version of the app in May 2020. Anyway, this unexpected stop gave Trentino Salute 4.0 enough time to work on the technological side of the project by taking into account all the feedbacks received from citizens and associations collected until then, and laid the foundation for the new release of the app in December 2020.
Talking about success factors, what do you think is your X factor?
Well, I think that the holistic approach to the promotion of health and healthy lifestyles by following the paradigm, the healthier your behavior, the greater your help to others, can trigger horizontal synergies among different stakeholders of the territory and reinforce even vertical relation between the territory and the institutions. A virtuous community that is attentive and committed to promoting healthy and healthy lifestyles can be then also the key for a sound economics and a social commitment on the territory.
Is there any lessons you learned from this experience?
Well, of course, this holistic approach, this digitally enabled and person-centered holistic approach to healthy lifestyle and well-being, where citizens and components of civil society are engaged through a co-creation process to improve themselves and the community in which they live, is the key to bring public services closer to people.
What is the main outcome of implementing this mHealth solution?
Well, the figures of the first operational phase of the solution, which will end on this year, on 31 December, are about 3,500 citizens involved, 20 selected social initiatives, 15 of which actually funded, and 10 commercial partners.
And what is the status? At what age is the project?
The app currently available is still in a pilot phase, but the release of the fully operational version, initially planned in May 2020, was prevented by COVID-19 pandemic outbreak, so it's now foreseen for December 2020, while the official launch will be, I think, in spring 2021, after an appropriate promotional campaign on the territory.
There is something you would have done differently. What can still be implemented?
A stronger engagement of citizens could be achieved with different interaction with the chatbot, which had at the beginning a too imperative tone, not always fully in line with the aim of guiding the user to an enhancement of his lifestyles. A major challenge should be the full integration of the app with the digital health ecosystem already implemented in Trentino, namely TREC, which is a personal health record enabling citizens to access, supplement, manage, and share their health data and well-being information.
Last question is about the future. Tell us about future plans for exploiting the mHealth solution.
Well, the new app, among other additional features, will propose new health targets to encourage behavioral change. And it also will link the promotion of health with the promotion of the territory by providing hints to local healthy food products and walks and excursion in Trentino.
Thank you very much, Riccardo, for your contribution, and good luck for your project. See you soon.
Thank you, Marcia, and let me say thanks also to Promise Network, which is the Italian network which gave us the opportunity to be engaged into the mHealth Hub project.